cremation, what will happen to the implant? Like after we die, what happens to the implant after we die?
Okay, that's a good question. It's mostly thermal labile, so it should just burn up in cremation. However, of course, there's some new implants, certain brands that may have a microchip or a metal part that may actually still be discerned by your relatives that happen to be picking up the ashes.
You still experience breast soreness during menses?
Actually, you may still, because correctly done breast augmentation should not disturb much of the breast tissue. So if you have a tendency to get periodic breast soreness due to the hormones, it should still remain the same, just like your ability to breastfeed.
Can the boob still bounce after surgery? And how much to what extent?
The boobs will still bounce, honestly, unless there are issues that's happened like capsular contracture where the implant may appear a bit stuck on. The implant should still bounce, especially a silicone implant. But I would recommend good support bra because that would ensure good longevity of the implant placement.
In this day and age, do the implants still burst?
Well, the technical term is rupture, not burst. It can still happen. It's a medical device. It rarely happens. And sometimes patients, after a certain number of years, they come back to me saying the shape of the implant or the shape of the breast has changed, and we notice that's an implant rupture on imaging. And interestingly, in my experience, it's often on the left side of the patient.
Can you still breastfeed with implants?
Yes, of course you can. However, your ability to breastfeed depends on various factors. And I have to say, some of the patients undergoing breast augmentation comes to us with an AA cup. So the starting point is that they may not have that much of a breast tissue. So even if they can breastfeed, the amount of milk production may be slightly on the lower side. Okay, even though the breast now appears much larger with augmentation.
So like, is it a flat pricing? Some people will say if the price is the same, I get bigger breast.
Yes, usually I charge $100 for 100cc and $200 for 200cc. No, I'm just kidding. The price of the implant depends on the brand and also the type of implant. So for the same type of implant for the same brand, the price is actually the same. All right. Unless if you need a special order of like 800cc implant, that may have a certain surcharge, of course. But let's not get there with an 800cc implant.
Can I go bra-free for the rest of my life?
I would usually recommend patients to put on good support bra for the rest of their lives, especially when they're doing certain bouncing activity. That affords good longevity of the implant. But of course, there's nothing wrong with going bra-free, especially if you have chosen a reasonable size. I would say maybe below 350cc. I mean, for select situation where you want to go bra-free, I think it's fine. Okay, but not when you go horse riding, you know, or jumping on a trampoline, for example. Yeah.
Do the breast still sag? Even with implants?
Yes, just like any natural breast, your existing tissue with time and age would actually sag, but the degree as to how it will sag depends on the various factors like the patient's skin quality and also, of course, the size of the implant. So it's very important to discuss this very seriously with your surgeon to decide on an implant size that's appropriate for your body anatomy, at the same time also the expectations of the potential to sag over the years. And maybe even choosing certain implants that are lighter, that by 20-30%, that would certainly help you in preventing the implant and breast from sagging over the years.